Hello people, good afternoon. This live session we are going to talk about HMPV virus. We are hosting this event and today Dr. Kushal Ravishankar would be live with us to talk about the virus and how it is going to affect children, how we can safeguard our children, and all the questions that you have in mind as well you can put forth, so that towards the end of the video we'll take all those queries. So please comment and tell me if you can hear me. We'll wait for a few more people to join in and we will invite Dr. Kushal to join us in. Yeah. Hi, Chandana. Yeah. Please let me know if I'm audible. People, this is a live session. We are discussing HMPV virus in children. I'm going to invite Dr. Kushal, who is a pediatrician. Yes. Dr. Kushal, I am unable to add you. Let me check again. And we'll be talking about HMPV virus, something that's been a concern, something that we're all worried about. Yes, I guess Dr. Kushal is here. Hello.
Am I audible? I think my video has some issue, I believe.
Yes, you are audible, Dr. Kushal, but we are unable to see you.
Hmm.
Now you're, yeah, kind of.
Okay, my camera is reversed. All right.
Initial hiccups are always there. So nice to
Yes,
meet
yes,
you.
yes. Yes,
How are
thank you,
you,
thank you.
Doctor?
I'm good, I'm good, I'm good. Thank you so much.
Thank you for joining in.
Yes, thank
Thank
you.
you for accepting the request to talk about the HMPV virus, something
Yes,
that parents are worried about, and something that many doctors have put forth in their videos saying that it's not something to worry about yet, though.
yes, yes, true.
So we have a few audience who have joined in, and many people will be joining in. It's not an issue because we'll be saving this video.
No problem.
So continue with our discussion. I will be putting in the questions that are relevant around this topic, and
No
we
problem.
can get answers through you.
No problem.
And then we will also put it open for our audience here. Meanwhile, they can keep putting in questions.
Sure.
My team member Chandana will send me questions and I'll
No,
ask that you. This would be the
no problem. No problem. That's fine. That's
okay.
fine.
Thank you. Before we start, I would like to request you to give your introduction.
Okay. I am Dr. Kushal Ravikumar. I am a pediatrician and neonatologist. I've been practicing for the past 6 years in JP Nagar Kamakshi Hospital and Kushal Childcare, which is my clinic. So I've been associated with tots and moms for the past 5 years. Actually, when I started my clinic was when I came in touch with Miss Kavita also. So we've been in close touch. We've done a few live sessions before where she's been generous enough to give me this platform
Oh,
to express my views and share my opinion about certain things which are better discussed on social media because we are able to reach a larger audience and we're able to clarify a large number of doubts in a short span of time. So thank you so much.
thank you so much. You were kind enough saying that. And 5 years, I mean, I cannot believe 5 years.
Yes.
So diving into it at first, we would like to know what is this HMPV?
HMPV virus, like other viruses, generally, if you go by classification per se, it belongs to the Paramyxoviridae family. So it is just a family, like ಇವಾಗ ನಮ್ದ್ರಲ್ಲಿ ಒಡೆಯರ್ಸ್, like we have ಒಡೆಯರ್ಸ್, we have arrests, so something like that. So it belongs to the Paramyxoviridae family. It has been around for a very long time, since 2001. That was when it was first identified. So since then it has been around, but there has been an occasional spike in infections. So that does not mean that it is a new infection or it is something new like what happened with COVID. So it has been there for some time, but because in winter, generally the spikes of this particular infection generally happen in winter and early spring. So that is why there's a lot of huff and puff about it, because this is the season when it actually becomes more recognizable. So that is why. So it is just a common virus, circulating virus, which generally causes symptoms of upper respiratory, meaning cough, cold, fever, and lower respiratory, maybe in certain cases in people who are maybe having weaker immunity, infants and older age group, where we can present with lower respiratory, like can have a very bad cough and pneumonias as well. But it is not the case in most. It is very rare, lower respiratory infections. Upper respiratory is most common, is what we are seeing in our regular practice.
Okay. I also read the same around it, but definitely it is not something that we can quickly understand, and hence let us know. The main question in parents is how is it transmitted? Because we send in our children day in day out to school, play areas, and do we need to fret? How we need to safeguard?
Yes. How it does spread, spreads by droplets, like any other respiratory infection, by salivary or respiratory droplets. So now how do we need to safeguard? Now that becomes an issue, because in kids we are no longer using masks again. But having said that, as I said before, it is not a very dangerous infection. So most common thing is, when parents, every child comes down with fever, the first day they are in my OPD saying, is it HMPV? So I tell them it is fine, don't worry. Even if it is HMPV, it can be HMPV. It does not mean that we have to test, or it does not mean that your child will have a much severe infection just because it is HMPV. So it transmits by respiratory and oral secretions, or by very close contact, like if you're sleeping with them, playing with them, sharing food, sharing water bottles, then yes. Or maybe soiled linen, like if they're using a kerchief or a towel, they clean their face, then you're using it again immediately. Then, so basic hygiene measures: wash your hands, make sure you use clean linen. If you're going to a very crowded place, make sure either your peers are wearing a mask, or at least you are wearing a mask for your own safety. So by this, I think we can avoid transmission of not just HMPV, almost all respiratory infections. As we can see in pediatric practice, we have no, like literally very less respiratory infections from March to May when there's summer holidays. Come June, we see a sudden spike. And not just in schools, in the house as well. The child falls sick, the entire family is sick. So this is the way we have to avoid. So by good respiratory measures, I think that is something we have to discuss with the school authorities as well, as to what we can do. Because yes, children do not wear mask for a long time. Are we able to keep any adequate distance in class? But not all schools have enough space. So that is something for another day. How we can do, I think Ms. Kavita will be in a better place. Maybe she can involve someone from public hygiene and find out that is there anything we can do in school per se for this. I'm not sure, but yes, these are the measures: prevent overcrowding, hand hygiene practices, and using good and clean linen.
Thank you, doctor. Thank you for saying that. But again, as soon as you say that children have to wear masks, most of the parents will. Uh, this is not a near possibility, as you said that, and I also have a 6-year-old who is the youngest, and
Yes.
for me, now it is something that it is impractical. But common flu and HMPV, cough, cold, fever, these are something that is easily treatable, and these are something that will not affect them a lot. If you say so, then maybe we will not fret much.
But one thing we can do is, the kids who are sick, I humbly request all the parents that if your child is sick, if you have any trace of fever and you feel that this cough is not an allergic cough, obviously you'll have your pediatrician who is nearby your house, who've been in touch with you. If they say it is viral or infective, I would strongly recommend you don't send them to school for at least a couple of days, so that the risk of transmission is averted. Obviously, I know most parents are working, and even they have a lot of problem having kids at home because there's no one there at home to take care. But this is something as a community I think we need to build on, because that is the only way we can prevent risk of transmission. Luckily, it is HMPV. It is not that severe, but someday in the future there will be some viral outbreak which is going to be much more severe than this. So at that time, I think it becomes the responsibility as a whole. It depends upon us, the community, to make sure, and we have to create a safe space for parents as well. Somehow they're given an option of working from home if possible also. So not just the children, we have to take care of the parents as well, because we should not hurt their pockets. So it has to be a balance. It has to be a community effort, not just a single person who can do this.
Amazing. This coming from a pediatrician and this coming from a human who can understand the basic concern when a child falls ill, and if it is a wholesome space where we can definitely inform our, wherever we are working, if they are so comfortable giving all this to us, nothing like it, and we would not be so much. Thank you for talking about it. I really hope people listen to this now.
Yes.
Okay, so what are the signs and symptoms? I think partially you have covered it, but if you have to quickly.
Yes. So generally, most of the time, it is upper respiratory. So what is upper respiratory? It is something that is above the larynx and not involving the lungs. So upper respiratory, we can have cold, sore throat, a lot of runny nose, maybe a bit of heavy-headedness as well. So these are the most common things we see. It may progress if you have a weakened immunity, let's say in children below 5 years and above 65 years. This is what is statistically given as well, that HMPV in children below 5 years and elderly above 65 years, they are the ones who are suffering the most with lower respiratory infections, where they can have with something called as bronchiolitis and bronchitis, where the airway tree is involved, and pneumonias, where the lung is involved. So we have to be a little careful about that. So generally, what you have to observe in your child is, if your child is having fever, cough, and cold, don't worry. But if your child is having difficulty to breathe, chest retractions, what we call in Kannada pekkesulu, that, and your child is not able to feed, is becoming very drowsy, then immediately you have to consult the nearby pediatrician, get their saturation done. And then again said, do not panic. It is something that is treatable. We have not reached a stage, or we have not seen any child who has succumbed to it. Only delayed referral, like you're going to your doctor very late, then sometimes it can be a little severe. But I'm sure that if you have access to the internet and you're watching this right now, I'm pretty sure you're not in a remote place, and you definitely have access to a nearby pediatrician. So make sure you have good access, and make sure where to go to, not for just this illness, any illness.
Thank you. Yeah, when to go to a doctor matters a lot. Sometimes we fret in the first sneeze of our child, and sometimes there is a negligency. Being
Correct.
somewhere what is right and what is the right balance definitely matters. I'll go to the next question. Are there similarities between this outbreak and early stages of COVID-19? These are actually people, these are questions given by doctor, because these are the ones generally asked to the
Yes.
doctor clinic.
So what happens is, the media coverage has been as brutal as COVID. I'm telling you
Yeah.
that. Yes. Other than that, yes, it is a respiratory infection, but as I said, it is a completely different virus. It is we are not seeing any signs of COVID, like similar symptoms of COVID. COVID again was a new virus. See, your body was not exposed. That is why we call it as a novel coronavirus. It belonged to that family, but it was something very different. So our body had no idea how to fight it. This HMPV is a circulating virus. It has been there since 2001. So there is no major change in the viral antigen. Whenever the body is fighting a particular disease entity, if there is a similarity to the previous infection or the infecting organism, generally there will not be much of a problem, because the body will recognize it early and is able to mount a good immune response. ಇವಾಗ ಹೇಗೆ ಅಂತಂದ್ರೆ, ಇವಾಗ ಪಕ್ಕದ ಮನೇಲಿ ಕಳ್ಳ ಬಂದ ಅಂತಂದ್ರೆ, ಕಳ್ಳ ಹಿಂಗಿದ್ದ ದಪ್ಪಕ್ಕಿದ್ದ ಅಂದ್ರೆ ನಾವು ರೆಡಿ ಆಗಿರ್ತೀವಿ. Oh, dappa kirone bandre. Okay, we know that somebody is going to come. We know how a robber will look like. But if it's someone completely different, a kalla who's wearing shiny shoes and posh clothes, then we will not know. So it is something like that. Now this HMPV is similar to what it was before. So we have been exposed, we have been infected 100%. If you've been here since 2001, you would have had at least one HMPV infection. So your body knows how to fight it. But COVID was not like that. It was something completely different. Although it was from the coronavirus family, it was a novel coronavirus. So what happened was we had no idea, our body had no idea how to fight it, unlike HMPV. So there are similarities in that the symptom wise, but the severity wise, definitely no. As of now, it is just behaving like any other respiratory infection.
Okay. So, do you mean to say if once we are affected by HMPV, we will not be affected by it again, or it will not be severe, anything like that?
Yes, if it is a similar strain of HMPV, yes, you will not have a very severe infection to it until and unless you are immunocompromised. Let's say you 3 4 years back you had a HMPV infection, but since then you have developed diabetes or you've been put on some medicine which is hampering your immunity, then the chances of you getting a little severe infection is higher, but that doesn't mean that you will have a very severe infection. Okay, so if you're already infected, the chance of you having severe infection is lesser. But then again, in kids who are less than 5 years, for them it is something new. They were not exposed before. So that is why they'll have a severe infection. And in adults who are above 85 years, in whom the immune cells are a little on the weaker side, then yes, they are also the chance of infection becoming severe is higher. But other than that, in generally the working class population, we are hardly seeing any severe infection.
I'll move on to the next question. Is there a vaccine for HMPV?
As of now, no, because it is not a severe infection. So not too much of time has been spent on it, but there is one in the pipeline because they always prepare for such outbreaks, because after COVID now entire world vaccinology is better prepared. So there's another virus called as RSV, respiratory syncytial virus. It is also circulating virus, but it has been actually causing a lot of problems for us. So along with that, even HMPV virus vaccine is in the pipeline. So in the next few years, we should have it. But as I said, we will have a vaccine, but will it be relevant by then? I'm not very sure. Relevant by mean, I'm saying that if it is not a severe disease, we don't expect you to get vaccinated by it. Number two, because we already have such a big vaccination schedule, so I'm not sure where we will squeeze it in. Number two, if the virus has to stay the same. So, like say they made a coronavirus vaccine and we get a novel coronavirus, then the old vaccine becomes redundant. So, similarly, if the virus mutates to such an extent by the time the vaccine is out, then we are not sure what relevance it carries. But then, yes, there is one in the pipeline, and I'm sure in the next few years there should be a vaccine out.
Okay, thank you. People, I have one or two more questions, and meanwhile, if you have something, you can pour it in. We will ask that to our pediatrician doctor here. So, we'll move on to the next question, which is how can HMPV be prevented?
Yes, HMPV as of now, prevention is the only thing we can do. So, as I said, hand hygiene, keeping your hands clean, make sure that before you're eating, before you're going to meet your closed ones, the younger ones or elder ones, make sure you're clean. Wearing masks in crowded areas, which is very important. It may be workplaces or it can be functions. Make sure you're always wearing a mask. If possible, in a way, in schools also. As I said, it's a discussion for another day. And using clean linen, that is very important. And as a society, we must make sure that we keep our environment clean. So if it is clean, then obviously the chances of it spreading is much lesser. So it's a community effort. We can't always keep questioning the government for it. The government does its job, sometimes it doesn't. So we have to be aware and we have to make sure that we are on our tiptoes and do something about it, because that is what matters right now. That is why.
Okay, thank you, doctor. Thank you for bringing in awareness. And this is a season of cough, cold, fever, and along with this HMPV coming in, it is definitely, I mean, troublesome for the parent minds. And is there something else that is being shown up? Is there something else that parents are worried these days? Or
Yes, thank you for bringing it up. I think this was a very good topic. I think it just came at the back of my mind. I didn't know how to express it. See, this year from August till Jan, we have had episodes of viral spikes. So three major viral outbreaks have been there, which is unheard of. Earlier, we used to have one a year. That's it. Now, in just a span of 5 to 7 months, we have had three viral spikes. Most of the parents, they are in my OPD. I see a child on Monday, child is better by Friday. In the next couple of days, next Monday, the child is gone to school. In the evening, they're again in my OPD seeing the child is sick. This is because the number of viruses and the virulence, the chances of them infecting has become very high. It does not mean your child immunity is down, you are not taking care of your child well. Most of the parents are very worried. They are restricting the child from playing outside. Please do not do that. Yes, you can restrict certain sugary foods because they tend to hamper immunity, but please, a child has to grow. He has to play. He and she have to play with their friends. They have to be exposed. Please do not lock them up. Let them play. This is happening with all kids, and that is how they learn. That is how the immunity will learn. They have to fall down. Only then will they learn running and cycling. Similarly, the immunity has to learn. They will falter initially. Don't be worried about infections. These are not very severe infections. If there is such an infection, I'm pretty sure the government will release certain guidelines. Your pediatrician will tell you about it. Until then, please make sure you take care of your child's development. The immunity wise, 95 to 99% of the kids have good immunity. If they have certain respiratory infections like asthma and bronchitis, then there are certain medications. Please make sure they're on their medications, but do not restrict their playtime, because we are seeing a lot of kids having developmental issues because they are not playing outside. They tend to be very secluded. They tend to have a lot of emotional issues. We don't want that coming out as a byproduct of this. So please don't lock them away. Don't worry about the infections. We are there to take care of you. There are a lot of other pediatricians around who will be of help all around the year. So don't worry. You will be taken care. You just make sure your child grows well.
thank you so much for bringing in that topic, which generally we ignore. We keep telling. I also talk to my child's school. Every time I go there, I request them to put them on under the sun, because my child leaves to school by 7:30 and they lock them up in their classroom. Even the prayer is read out in the classroom. I continuously request them, but unfortunately, most parents are academic oriented. Only I or you cannot fight. We have to, as a community, come up and understand vitamin D is important. Only sun can give it to you. Your child has to fall, get up. Only then he will learn. I mean, physical growth and also mental growth. How to handle it. How to be emotionally strong. How to deal with issues, small or big. I mean, this is a learning phase, and if we put them, I mean, inside the door, there is nothing that our child will learn. And tomorrow, the child who has to be independent will
Yes,
be a burden, not
correct,
just on us parent, on the society as well.
correct.
So, thank you for bringing that up. And Doctor, thank you so much for joining in. And
No
we are
problem.
really happy and really glad that you could pour in all these details. I know you were not keeping well the last week. I can
Uh,
sense your voice is feeble, that
yes, yes.
affected.
Yes, I'm sorry for that.
So,
My voice has fully not recovered, so I'm on my part to recovery. But then, yes, I'm better now. So, but first of all, thanks to you. So, let me just share that Miss Kavita, she does a lot of work. Not just her, any social influencer. I want to say this is just as a public thing that always be positive when you give comments on a social media account, because the work they put in is exceptional. Because I have actually tried doing this a couple of times and have never been satisfied. And I somehow see on your account alternate day there is something coming up with such crisp. Your talk is so crisp, the video taken is so crisp. So I just want to say to the public that when you hear see such videos, learn something. Please don't be very harsh about, not just on this platform, any platform. To social media creators, they put in a lot of effort, and I know that you are also very busy. You run a factory, you have so many people under you. Actually, considering our schedule, I think you are more busy. So thanks to you for taking time and making sure that you're going out of your way to bring this out to people. So thank you, and I hope that you continue doing it. And I'm pretty sure, even though they may not say it in the video, that it is very helpful for as a community. As I said, somebody has to stand up for the community, and I'm pretty sure you're one of them. And I thank you so much, because obviously I can't make videos, and the ones who make videos, I'm ever grateful to them. Thank you so much.
Thank you, Dr. Kushal. And for anybody and everybody joining in, now we will save this video. You can watch it later. And Dr. Kushal, you can also share it with people coming into your clinic so that they
No
get
problem.
personal information from you. And thanks for being so kind, and thanks for
No.
joining in. Wish you good health, every health. Good day to all of you. Bye bye.